My name is Sheryl Sledge, and I will be presenting my RN to BSN Midwestern State University Capstone project. My project was on the effectiveness of hourly rounding in fall prevention in an acute care setting. Fall prevention is for everybody. The objectives for this project are as follows: to assess the importance of preventing falls in the acute care setting, to assess the importance of preventing falls with injury in the acute care setting, which are considered sentinel events, which are reported to the Joint Commission, to assess the effects of hourly rounding in relation to falls and falls with injury in the acute care setting, to identify the financial ramifications of falls in the acute care setting, and finally, to incorporate the practice of hourly rounding into the nursing unit routines. As an introduction to the topic, the Agency for Healthcare Research and Quality in 2021 estimated that between 700,000 to 1 million patients fall each year, and more than 1/3 of those falls that occur in the hospital setting result in injury to the patient. Medicare and Medicaid services no longer reimburse hospitals for costs associated with a patient fall, as they feel it is a preventable event. This topic is very personal to me. Recently, I had a family member in the hospital that had a fall that resulted in injury. The fall resulted in the need for an increased level of care and increased length of stay. It also caused us to consider the patient when they were going home. Should they go home alone? The patient actually ended up going to rehab and then to assisted living as they had subsequent falls. Patient falls are a common occurrence in acute care settings. Patients find themselves weak due to illness and in unfamiliar surroundings. Patients that would normally not be at risk for a fall suddenly are due to a change in their condition. This could be as simple as a addition of a new medication. Some medications will cause dizziness or lightheadedness upon arising from a chair, and patients do not realize that that can occur. So they get up without assistance and subsequently fall. Patients often try to get up without assistance, not wanting to wait for help from staff, resulting in patient falls. Fall prevention is important in acute care, as patient safety is key to all that we do as healthcare professionals. Positive patient outcomes, both medically and in regard to patient satisfaction during hospital stays, is significant for all healthcare organizations. Our goal in healthcare is always to avoid patient harm. The World Health Organization in 2021 rated fall with injury as the second leading cause of unintentional deaths, and an estimated 684,000 individuals die from falls yearly worldwide. In 2021, Harden et al. Stated that patient falls remain at the forefront of patient safety, falls are preventable, and falls with harm lead to longer hospital stays and costs. All healthcare institutions prioritize falls as a major safety issue that is managed by nurses daily. This topic is clinically significant, as fall events in the hospitals both during and post-pandemic have risen. As at the facility where I work, fall events are elevated. The Falls Committee recently reported that we have had 131 fall events so far this year, compared to 126 in 2021, with 16 of those falls resulting in harm to the patient. Financially, for acute care facilities, a fall is costly for the hospital, as the patient will have an extended length of stay and require increased monitoring. As previously stated, Medicare and Medicaid do not reimburse hospitals for costs associated with a preventable fall. Providing quality health care to patients includes patient safety and preventing harm. The Agency for Healthcare Research and Quality defines patient safety as avoiding harm to patients from care that is intended to help them. The expert I interviewed reported that recently, one patient fall resulted in a cost of $180,000 to the facility. While I knew falls increased overall cost of care, I had no idea just how high that amount was. My PICO question is, in acute care, how does the implementation of staff hourly rounding compare to no hourly rounding and the incidence of patient falls? The 9 articles I analyzed overall reported that purposeful hourly rounding is worth the time and effort to implement, as results showed a decrease in patient falls when hourly rounding was instituted. Gleiner et al. In 2021 and Spano-Flensky et al. In 2019 reported that fall events can potentially decrease anywhere from 21 to 54% when hourly rounding is implemented. Overall, hourly rounding was found to increase communication between staff and patients, decrease call-out usage, and decrease patient fall events. Implementation of this plan would consist of staff education prior to rollout and ongoing during onboarding of new staff. There would have to be 2 classes, one for licensed and one for unlicensed. Both classes would include education regarding the 4 Ps: pain, potty, position, and possessions, a review of the fall prevention policy, and a review of hourly rounding, which would be on a schedule hourly from 6 a.m. to 10 p.m. and every 2 hours from 10 p.m. to 6 a.m. on the night shift. RNs would also get a review of the Morse Fall assessment requirements, and that assessment should be done on admission, every shift, and with any change in condition. The big key there is changes in condition. We would have to review with nursing what actually institutes a change in condition. This could be the patient going for a procedure that required any kind of IV conscious or general anesthesia. It could be the addition of a medication. It could be the addition of several medications, or it can be as simple as a pain medication or an anti-anxiety medication. Any of those things would cause a change in the patient's condition that could increase their fall risk. Patients would also be included in this, as they would be provided fall prevention education on admission with reinforcement as needed, and they would also be presented with a fall prevention contract on admission, which they would be required to review, read, and sign and share with their family. Evaluation would be on an ongoing basis, as this is a project improvement. This is a process improvement project. All patient fall occurrences would be reviewed and a post-fall huddle form utilized. We would obtain call-out usage from our vendor to monitor if our call-out usage was increased, decreased, or if we were noticing no changes. We would also obtain our staff locator badge data from the vendor. All staff in our facility have a locator badge which shows when they go in and out of patient rooms, so we would be able to monitor for rounding compliance in that way. We would also analyze call-out usage and hourly rounding in correlation with any fall event that did occur and complete a root cause analysis. With that, and with the fall huddle data, which was what was occurring on the unit at the time, hopefully we would be able to identify places where we could improve our process. After 90 days, we would survey staff to gain feedback as to what is working well and where there are areas for continuing improvement. During implementation, we would go over rounding expectations during daily huddles on the unit, and that would include the nurse manager, charge nurse, and staff. All fall events will be entered into the event monitoring application and post-fall debriefing completed with staff at the time the fall occurs. The falls committee will meet monthly and monitor the progress of the implementation. The results of the intervention will be disseminated by having the data compiled into a PowerPoint form and presented to the falls committee. All recommendations and data for the falls program will be provided to senior leadership and the hospital board for their review. Finally, the analysis and final manuscript will be submitted to the American Journal of Nursing for approval for publication. In summary, in 2019, the Agency for Healthcare Research and Quality estimated that 700,000 to 1 million hospitalized patients fall each year. In 2021, the World Health Organization estimated that 684,000 individuals die from falls yearly worldwide. Those are astronomical numbers. Acute care facilities are working diligently to reduce those numbers, and this literature review supports instituting evidence-based practice hourly staff rounding with a fall prevention program to reduce the incidence of patient fall and patient harm. Thank you for your time and for listening to my presentation.